Polyvagal theory, a primer. Part 2. This is written by Dr. Stephen Porges. The integration of the myelinated cardiac vagal pathways with the neural regulation of the face and head give rise to the mammalian social engagement system. The outputs of the social engagement system consist of motor pathways regulating striated muscles of the face and head, example somatomotor, and smooth and cardiac muscles of the heart and bronchi, visceromotor. The somatomotor component involves special visceral efferent pathways that regulate the striated muscles of the face and head. The visceral component involves the myelinated supradiaphragmatic vagal pathway that regulates the heart and bronchi. Functionally, the social engagement system emerges with the face-heart connection that coordinates the heart with the muscles of the face and head. The initial function of the system is to coordinate sucking, swallowing, breathing, and vocalizing. Atypical coordination of the system early in life is an indicator of subsequent difficulties in social behavior and emotional regulation. When fully developed, two important biobehavioral features of this system are expressed. First, bodily state is regulated in an efficient manner to promote growth and restoration. Example, visceral homeostasis. Functionally, this is accomplished through an increase in the influence of myelinated vagal motor pathways on the cardiac pacemaker to slow heart rate, inhibit the fight or flight mechanism of the sympathetic nervous system, dampen the stress response system of the hypothalamic pituitary adrenal axis, responsible for cortisol release, and reduce inflammation by modulating immune reactions, the cytokines. The social engagement system consists of a somatomotor component and visceromotor component. The somatomotor component involves special visceral efferent pathways that regulate the striated muscles of the face and head, while the visceromotor component involves the myelinated vagus that regulates the heart and bronchi. The phylogenetic mammalian face-heart connection functions to convey physiological state via facial expression and prosody, the intonation of voice, as well as regulate the middle ear muscles to optimize species-specific listening within the frequency band used for social communication. The brainstem source nuclei of the social engagement system are influenced by higher brain structures, top-down influences, and by sensory pathways via visceral organs, the bottom-up influences. Direct pathways from cortex to brainstem, the corticobular, reflect the influence of frontal areas of the cortex, the upper motor neurons, on the medullary source nuclei of this system. Bottom-up influences occur via feedback through the sensory pathways of the vagus, conveying information from visceral organs to medullary areas, the nucleus of the solitary tract, and influencing both the source nuclei of the system and the forebrain areas via the insula that are assumed to be involved in several psychiatric disorders, including depression and anxiety. In addition, the anatomical structures involved in the social engagement system have neurophysiological interactions with the HPA axis, the social neopeptides such as oxytocin and vasopressin, and the immune system. Sensory pathways from the target organs of the social engagement system, including the muscles of the face and head, also provide potent input to the source nuclei, regulating both the visceral and somatic components of the social engagement system. The source nucleus of the facial nerve forms the border of nucleus ambiguus, and sensory pathways from both the facial and trigeminal nerves providing a primary sensory input to the nucleus ambiguus. Thus, the ventral vagal complex, consisting of nucleus ambiguus and the nuclei of the trigeminal and facial nerves, is functionally related to the expression and experience of affective states and emotions. The activation of the somatomotor component, example through listening, ingestion, vocalization, facial expressions, could trigger visceral changes that would support social engagement, while modulation of visceral state, depending on whether there is an increase or decrease in the influence of myelinated vagal motor fibers on the synaptial node, example increasing or decreasing the influence of the vagal brake, would either promote or impede social engagement behaviors. For example, the stimulation of visceral states that promotes mobilization, example fight or flight behaviors, would impede the ability to express social engagement behaviors. The face-heart connection enabled mammals to detect whether a conspecific was in a calm physiological state and safe to approach, or in a highly mobilized and reactive physiological state, during which engagement would be dangerous. The face-heart connection concurrently enables an individual to signal safety through patterns of facial expression and vocal intonation, and potentially calm an agitated conspecific to form a social relationship. When the newer mammalian vagus is optimally functioning in social interactions, the emotions are well regulated. The vocal prosody is rich, and the autonomic state supports calm, spontaneous social engagement behaviors. The face-heart system is bidirectional, with the newer myelinated vagal circuit influencing social interactions and positive interactions influencing vagal function to optimize health, dampen stress-related physiological states, and support growth and restoration. Social communication and the ability to co-regulate interactions via reciprocal social engagement systems leads to a sense of connectedness and are important defining features of the human experience. Vagal brake. The vagal brake reflects the tonic inhibitory influence of the myelinated vagal pathways on the heart, which slows the intrinsic rate of the heart's pacemaker. The intrinsic heart rate of young, healthy adults is about 90 beats per minute. However, baseline heart rate is noticeably slower due to the influence of the vagus, which functions as a vagal brake. When the vagus decreases its influence on the heart, the vagal brake releases, the heart rate spontaneously increases. This is not due to an increase in sympathetic excitation, rather it's due to the release of the vagal brake, allowing the rate intrinsic in the pacemaker to be expressed. The vagal brake represents the actions of engaging and disengaging the vagal influences to the heart's pacemaker. In addition, the release of the vagal brake on the heart also enables tonic underlying sympathetic excitation to exert more influence on the autonomic nervous system. Polyvagal theory specifically assumes that the vagal brake is mediated solely through the myelinated ventral vagus and can be quantified by the amplitude of respiratory sinus arrhythmia. The theory acknowledges other neural, example, dorsal vagal pathways, and neurochemical influences that can slow the heart rate, example, clinical bradycardia, which is not included within the construct of the vagal brake. Dissolution. The human nervous system, similar to that of other mammals, evolved not solely to survive in safe environments, but also to promote survival in dangerous and life-threatening contexts. To accomplish this adaptive flexibility, mammalian autonomic nervous systems, in addition to the myelinated vagal pathway that is integrated into the social engagement system, retained two more primitive neural circuits to regulate defensive strategies, example, fight or flight and death feigning behaviors. It's important to note that social behavior, social communication, and visceral homeostasis are incompatible with the neurophysiological states that support defense. Polyvagal response strategies to challenge are not phylogenetically ordered with newest components. Polyvagal response strategies are phylogenetically ordered with newest components of the autonomic nervous system responding first. This model of autonomic reactivity is consistent with John Hewlings-Jackson's construct of dissolution, in which he proposed that the higher nervous arrangements inhibit or control the lower, and thus when the higher are suddenly rendered functionless, the lower rise in activity. In this hierarchy of adaptive responses, the newest social engagement circuit is used first. If that circuit fails to provide safety, the older circuits are recruited sequentially. Neuroception. Polyvagal theory proposes that the neural evaluation of risk does not require conscious awareness and functions through neural circuits that are shared with our phylogenetic vertebrate ancestors. Thus, the term neuroception was introduced to emphasize a neural process, distinct from perception, capable of distinguishing environmental and visceral features that are safe, dangerous, or life-threatening. In safe environments, autonomic state is adaptively regulated to dampen sympathetic activation and to protect the oxygen-dependent central nervous system, especially the cortex, from the metabolically conservative reactions of the dorsal vagal complex, example, fainting. Neuroception is proposed as a reflexive mechanism capable of instantaneously shifting physiological state. Feature detectors located in areas of and near the temporal cortex, which are sensitive to the intentionality of biological movements, including voices, faces, gestures, and hand movements, might be involved in the process of neuroception. Embedded in the construct of neuroception is the capacity of the nervous system to react to the intention of these movements. Neuroception functionally decodes and interprets the assumed goal of movements and sounds of inanimate and living objects. Thus, the neuroception of familiar individuals and individuals with appropriately prosodic voices and warm, expressive faces frequently translates into a positive social interaction, promoting a sense of safety. Although we are often aware of the stimuli that trigger different neuroreceptive responses, we are generally aware of our body's reactions. Autonomic state as an intervening variable. Polyvagal theory proposes that the physiological state is a fundamental part and not a correlate of emotion or mood. According to the theory, autonomic state functions as an intervening variable, biasing our detection and evaluation of environmental cues. Depending on physiological state, the same cues will be reflexively evaluated as neutral, positive, or threatening. Functionally, a change in state will shift access to different structures in the brain and support either social communication or the defensive behaviors of fight or flight or shutdown. Contemporary research on the impact of vagal nerve stimulation and cognitive function and emotion regulation supports this model. The theory emphasizes a bidirectional link between brain and viscera, which would explain how thoughts change physiology and physiological state influences thoughts. As individuals change their facial expressions, the intonation of their voices, the pattern in which they are breathing, and their posture, they are also changing their physiology through circuits involving myelinated vagal pathways to the heart. The role of sensations from bodily organs in the regulation of autonomic state. The prevalent focus of research investigating the neural regulation of the heart has focused on motor pathways emerging from brainstem nuclei, example, vagal pathways, and the sympathetic nervous system. Limited research has been conducted on the influence of sensory feedback from bodily organs, example, visceral afferents, in the neuroregulation of the autonomic nervous system, and how these influences are manifested in the heart and other visceral organs. This is in part due to a top-down bias in medical education that limits the conceptualization of the neuroregulation of the heart and other bodily organs by emphasizing the role of motor fibers and minimizing the role of sensory fibers. However, this bias is rapidly changing due to research on the applications of vagal nerve stimulation, a bottom-up model that focuses on the vagus as a sensory nerve. Approximately 80% of the vagal fibers are sensory. Interestingly, the side effects of vagal nerve stimulation are frequently due to the influence of vagal nerve stimulation on motor pathways. These side effects are primarily noted on features of the social engagement system, including changes in voice and difficulties swallowing. However, in some cases, the stimulation has been manifested in subdiaphragmatic organs, resulting in diarrhea. A vagal nerve stimulation becomes more commonly applied to medical disorders. There's an emerging awareness of the influence of the sensory pathways of the vagus on neurophysiological functions, example, epilepsy, emotional state, example, depression, and cognition, example, learning and attention. According to polyvagal theory, the social engagement system is regulated by complex neurocircuits. involving both sensory pathways from visceral organs, bottom up, and higher brain structures, top down, that influence the brainstem source nuclei controlling both the myelinated vagus and the striated muscles of the face and head. As the surveillance role of sensory pathways providing feedback from bodily organs to the brainstem is incorporated into an understanding of the autonomic nervous system, clinicians and researchers will begin to recognize manifestations of the vagal control of the heart in patients with a variety of disorders of peripheral organs. With that understanding, rather than interpreting the atypical neuroregulation of the heart as a cardiovascular disease, comorbidities may be explained as manifestations of system dysfunction, consistent with the prescient views of Walter Hess. Several chronic diseases manifested in specific subdiaphragmatic organs, example kidney, pancreas, liver, gut, genitals, etc., have identifiable features that have led to treatment that target organs, example medication and surgery. However, other disorders that have an impact on quality of life, such as irritable bowel syndrome and fibromyalgia, are defined by non-specific symptoms. The literature links these non-specific chronic disorders with atypical vagal regulation of the heart, reflected in diminished heart rate variability. Consistent with these findings, heart rate variability has been proposed as a biomarker for these disorders. Polyvagal theory proposes an alternative interpretation of this covariation, consistent with the integrated model of the autonomic nervous system described in the theory. Atypical heart rate variability is not interpreted as a biomarker of any specific disease. Rather, depressed heart rate variability is proposed as a neurophysiological marker of a diffuse retuning of the autonomic nervous system, indicating a withdrawal of the ventral vagal circuit following an adaptive complex autonomic reaction to threat. Compatible with this interpretation, there are strong links between the prevalence of a history of abuse, especially sexual abuse in women, and the manifestations of non-specific clinical disorders such as irritable bowel syndrome and fibromyalgia. In addition, emotional stress intensifies symptoms and hinders positive treatment outcomes, and trauma may trigger or aggravate symptoms. The initial adaptive neural response to threat via sensory feedback from the visceral organs to the brain stem may result in a chronic reorganization of the autonomic regulation observed in vagal regulation of the heart. Example, depressed heart rate variability in conjunction with altered subdiaphragmatic organ functioning and pain signaling.